Once you have completed your range of motion testing, both active, passive, and resisted, let's move on to cervical orthopedic test. This is where we can really narrow down the condition or the area that we need to focus on so that the client gets a very efficient and more importantly, an effective treatment and an effective outcome. So the first test that we're going to do is called a Spurlings test. So what are we doing with the Spurlings test? Looking for three things. We could be looking for nerve root impingement, a space occupying lesion, or facet joint irritation. So things that you're going to listen for when the client comes in. They have a dull, achy pain in their neck, and at times it could be a sharp local pain, and at times they could feel nerve pain down their arm into their hand, and possible a coldness in their hand. So again, sharp local pain, pain down their arm like a nerve pain, and possibly their hand going cold. So those are the things that you would listen for from that client. So the compression test is done in, compression or Spurlings test is done in 3 stages. So I'm going to stand behind my client, and their head, neck is in a neutral position right now. So I'm going to just kind of put my fingers together, place them on top of the client's head, and I'm going to just push straight down. It's going to be it's not a quick, but it's just push and release. Any pain or discomfort with that?
Nope.
Okay.
No.
The client might say, oh, I feel a little bit of pain when you do that. Okay. So what we're going to do is we're going to start loading up the joint. So let's say that the client had issues on the right side of their neck. So now, if they said, ooh, a little bit of pain, I'm going to bring their head into slight extension and rotation to the affected side. I'm going to use my hands again like I did before, put them on the top of the head, and I'm actually pushing that way towards the spine. So again, it will just be push and release. I'll bring it back to center. Any pain or discomfort with that? Okay. So if you think about it, when I bring the client's head into extension and rotation, we're putting a lot of pressure right in that area, right where the vertebrae are. A positive response or a positive test would be that they get a sharp local pain. That would be a sign of facet joint irritation. If they mention to you that it's more of a tingling or their hand goes cold, that would be more of a nerve root impingement, something of that nature. Okay. The last step in the Spurlings test is lateral flexion. So we'll bring the head into lateral flexion. Again, I'm going to lock my fingers together, push at an angle towards the spine. So I'm going to put him on top of his head, push and release, and again ask any pain or discomfort with that. Okay. Again, you would want to look for that either sharp local pain or pain running down their hand. The second test that you could do after the Spurlings test, which is basically a confirmation test. If they mention to you that they did have that local pain or the pain down the arm, what we're going to do is actually distract the cervical spine. So we're going to actually traction the head up. And what you're looking for here is if they got a pain with the Spurlings test, if we lift up on their head, that pain is actually going to go away. It will alleviate the pain. That is the positive sign. Because as we pull up, we're taking pressure off of the disc and the vertebra. So what I'm going to do is kind of just use my palms here, and I'm going to put them underneath his mastoid processes. You want to kind of get down into sort of a squatting position. Again, you know, anything we do where we're lifting or moving the client, it's best to have good body mechanics. And I want to lift up. I don't want to really lift with my arms, but I could use my legs. So I'm going to come behind his mastoid process. My fingers are just kind of on the side of his head, and I'm going to lift up like I was just trying to traction his neck. And I'm going to lift and then let go. And if he mentions to me that the pain that he felt with the Spurlings test is now diminished or gone, that is a confirmation test of either facet joint irritation, space-occupying lesion, or nerve impingement that goes down the arm. Another issue that we could test for in the cervical spine is TOS, or thoracic outlet syndrome. What kinds of things would you possibly hear from your client? When they came in, they might mention pain in the neck, but more importantly, they would be talking about a nerve pain that they're feeling in their arm, and specifically it would be talking about they would feel that numbing and tingling in digits 4 and 5. Again, just to kind of recap, from your studies, if they had nerve pain in these 3 fingers, these 3 lateral fingers and part of this finger, that's kind of more of a sign of carpal tunnel syndrome. But we're looking at these 2 fingers. So thoracic outlet syndrome. So you may remember from the cervical spine that a bundle of nerves called the brachial plexus exits the cervical spine, runs between anterior and middle scalene, runs under the clavicle, runs under pec minor, and then runs down the arm. So we can test for TOS in certain stages to see where that bundle of nerves might be impinged, where something might be pushing on it that would be causing the nerve pain down the hand. So let's start with Adson's test. What Adson's test is testing for is the impingement of that nerve, but with focus on anterior scalene. So here's how you run the test. The first step is to palpate the client's radial pulse. So remember, when you're looking for a pulse, don't use your thumb because you have a slight pulse in your thumb. It's best to probably use these 2 fingers to palpate that. So I'm going to just take my client's wrist and I'm going to palpate the pulse kind of right there by that pad of their thumb. Radial pulse, again, is just kind of right there by the radius. You'll feel it bumping right there. So I'm going to bring their arm here, might even just come down on a knee, more importantly. And you'll notice that I have his arm or his shoulder in slight abduction and a little bit of extension. That's the first part of the test. Next, I'm going to have the client look towards me. So ipsilateral rotation, because this is the side I'm testing. The next step is very important. I'm going to have the client take a deep breath in and hold it. He's going to hold that for about 20 seconds. Why is he holding his breath? Remember, the scalenes become tight when you take quick, deep breaths in. So they would get tight and could possibly impinge the nerve. What am I looking for? I'm going to ask my client to let go of his breath. The positive test here, as you palpate that radial pulse, he turns his head to this side, holds his breath. If this pulse diminishes in any way, or you can't feel it anymore, that would be a positive sign for TOS with anterior scalene involvement. Another test that we could perform for thoracic outlet syndrome, or TOS, is called Halsteads maneuver. It's also referred to as reverse Adson's possibly, but we'll look at it as Halsteads maneuver. So it's going to be the same steps that we did with the Adson's test, but this time the client is going to look away from the therapist, because now we're going to be trying to test middle scalene involvement. So again, what I will do is palpate the client's radial pulse. Again, it's just kind of best, body mechanics to maybe come down sort of at that level. Once you find that pulse, I'm going to bring my client's arm again into abduction, slight extension. But this time I'm going to have him look to the opposite direction. He's going to take a nice deep breath in, quick, and hold it. Again, he's going to hold it for 20 seconds. And again, that's going to make middle scalene contract. And what I'm looking for is to see if that pulse either diminishes or is completely absent. That would be my positive sign for middle scalene involvement. Relax. And that is the Halsteads maneuver. Another test for thoracic outlet syndrome is the military brace test, or it could be called the costoclavicular test, but military brace. So this time, and if you think about the word costoclavicular, we're talking about clavicle and first rib. So now we're looking to see if that bundle of nerves is being compressed between the clavicle and the first rib. So it's going to be looking for that radial pulse, but I'm going to look for it on both of the wrist at this point. So again, I'll come and ask my client to bring their arms behind them, and I'm going to look for that pulse bilaterally, both sides. Okay, once I have that, again, I'm going to bring the arms out, but I'm going to bring both arms back. And I'm going to ask my client to slump. So he's going to kind of just let his neck slump, but I'm also going to ask him to pull his shoulder blades together. So kind of bring your shoulder blades together. Okay, so we're looking for clavicle and first rib. And what this does is it brings the clavicle and the first rib closer together. I'll have my client hold his breath again and relax. And again, I'll look for that diminish in the pulse. Another test that we can perform for thoracic outlet syndrome, TOS, is looking for involvement of the first rib and the clavicle. It's called the costoclavicular test or military brace test. So I'm going to still palpate for the radial pulse. I'm going to ask my client to kind of slump forward, and when he does that, it's going to bring the clavicle and the first rib closer together. And we'll see if that affects that nerve this time. So he's going to bring his arms out to the side. Just kind of get behind the client and palpate for that radial pulse bilaterally, so kind of on both sides. Okay, once you find the pulse, the actions that you want to do now is I'm going to have my client kind of slump forward. So he's going to kind of bend his neck, slump forward, but at the same time, he's going to retract his shoulder blades, kind of bring his shoulder blades back. And then I'm going to notice if that pulse diminishes or if that pulse completely goes away. Again, those would be positive signs for clavicle and first rib involvement with TOS. The last test that we can perform for thoracic outlet syndrome is Wrights hyperabduction test. This test is going to see if pec minor would be the issue. So we're going to kind of go through the initial steps that we've gone through on the previous test. First thing I want to do is locate the client's radial pulse. Once I've located the pulse, I'm going to actually bring his arm higher into abduction. I'm going to push on his shoulder blade, bring his arm back, and actually externally rotate his shoulder. That way we're really stretching pec minor, and I'm looking for that diminish in the pulse or the absence of that pulse. And if that happens in this position, Wrights hyperabduction, that would show me that pec minor is my involvement with TOS. Another issue that you might face with cervical issues would have to also involve the scalenes. Your client mentions to you that they have kind of a dull, achy pain on the anterior lateral side of their neck, just a dull, achy pain. And remember, when we talk about a dull, achy pain, we're talking more muscular. It's not nerves or anything like that. It's just a dull, achy pain. So we're thinking muscle. So we can run a test called a scalene cramp test. So again, remember the scalenes are located right here on the lateral side of the neck, anterior lateral side of the neck, just behind SCM. So if my client mentioned that they're having pain, kind of that dull, achy pain, what I'm looking for is to see if there are active trigger points in any of these anterior, middle, or posterior scalenes. So this is an active test on the client's part. So what I'm going to have the client do is they're going to look to this affected side and actively tuck their chin into their clavicle. So Jared, if you would look towards me and kind of just hook your chin into your clavicle.
Okay.
And then I'm going to have the client hold this position probably up to about 60 seconds, no longer than that, but I could just have the client in this position and have them go ahead and come out. But what would happen if the client looked and tucked their chin in, it would reproduce that pain that they're feeling in the side of their neck. Now let's talk about trigger points for just a second. Remember, trigger points have referral patterns. So the client could also not only say that they have pain here, but they could have pain in their upper back, they might have pain in their chest, they might have pain in their arm. This would all be kind of a referral pattern for active trigger points in those scalenes. So if you kind of hear, pain in this area, let's run a scalene cramp test. And if you reproduce that pain pattern, it's a positive sign for active trigger points in the scalenes. So with regards to the Spurlings test for facet joint irritation or nerve root impingement, I just wanted to show you on the skeleton kind of what we're looking for, what kind of explain the test a little bit more. So, as the vertebrae are stacked, right here are the facet joints. And if you think about it, if there's any type of irritation around that, by us pushing on the head or rotating the head, we would be overloading that joint. So you'll also notice these kind of nerves, these representation of these nerves that exit through these, or between these vertebrae, I should say, that then innervate the arm. If we were to push or overload the joint, those nerves would be pinched. So that's kind of the concept behind the Spurlings test, where pushing down would overload the joint, rotating and extending the neck would overload the joint. And just as a reminder, if the pain stays local right there and is very sharp, we're looking at that facet joint being irritated. If the pain reproduces nerve pain down the arm, then it's going to be a space-occupying lesion, something that shouldn't be there, and nerve root impingement. That nerve is being pinched and causing that numbing and tingling down the arm. So with regards to the test for thoracic outlet syndrome, TOS, again, I just kind of wanted to try and give you a visual of what you're looking for or why we're testing for this. So this first green band represents the anterior scalene. The second green band represents middle scalene. And the red band represents the brachial plexus, that bundle of nerves that exits from the side of the neck. So it runs right between those two muscles. So can you imagine if one of these muscles is hypertonic or tight and it's a little bit bigger, it could be pushing on that nerve, and that is the cause of the pain and tingling into the arm. So that's why we test, one, having the client look towards the therapist, and one, having the client look away from the therapist to determine if anterior or middle scalene is involved. So I just wanted to, again, look at Wrights hyperabduction test, which involves pec minor with TOS. So the green band is representing pec minor. Pec minor originates on ribs 3, 4, and 5 and inserts onto the coracoid process of the scapula. So you can see how that red band, which is the brachial plexus, runs under the clavicle and then runs under pec minor. So if we were to bring the client's arm out into abduction and then pull back into extension, that is going to tighten pec minor, and that could be the involvement where it kind of compresses onto the brachial plexus. So the last test that we did was for, it's called the costoclavicular test or military brace test. That is clavicle and first rib involvement. So you may remember when I ran the test, I pulled both arms. I pulled both of the client's arms back behind the client and had him slump forward. So when he did that, when he slumped forward, that brought the clavicle and the first rib closer together. I had him retract his shoulder blades, so bring the shoulder blades back, and that would have really put a lot of compression onto the nerve between the clavicle and the first rib when he added all of that slumping forward. So that would be kind of the reason why we would run that military brace test.